In this series of short videos, we're going to talk about developing careers as clinician researchers. And you as academic leaders have a significant part to play in either developing your own clinical research career or facilitating the development of clinical research amongst your reports. Clinical research is really important because the research skills that clinicians should learn will actually enhance their own abilities as doctors. At the same time, it also improves the treatment that we can offer to our patients. Around the world, the number of clinician researchers is actually decreasing, and this is a problem because of what we call the translation gap. The translation gap is the gap between research and actually that research affecting patient care. The vast majority of research that we do has no impact on patient care. And it's thought that if we were to ask better questions, and these are questions that we think that clinicians are much better placed to ask, then when we find the answers to those questions, we have a more immediate mechanism by which those answers can be used to improve the care of our patients. I've been lucky enough to work in clinical centres that have been world leading, and these have been centres that have not been trying to be led by research, but actually to lead in research. And they've also been centres that have been affiliated with research centres or with universities. But the most important aspect of a centre and a clinical setting in terms of fostering research is that that centre practices evidence-based medicine rather than eminence-based medicine or experience-based medicine. So by this, what I mean is that the care that one provides is not determined specifically by an individual eminent person or by the most experienced person in the room, but actually is determined by the assessment of the available data in the literature or by the conduct of research in one's own unit. Evidence-based practice really encourages the younger clinician to be more active in research because they know that the research that they undertake or the evidence that they assess will have a direct impact on the care that they provide to the patients at their centre. In our own experience and culturally now, patients and consumers are much more involved in the design of research, so-called co-design, and also in the administration of that research. And this again is another factor that we think will shorten that translation gap. Critical to developing good clinical research is the ability to ask good clinical research questions. Now, all of us should be asking questions of our practice on a day-to-day basis. We need to ask ourselves every day, how do we improve our patient care? Can we diagnose their conditions better? Are there better tests? With the test that we're using, what's the sensitivity, specificity? What's the performance of the test? Are there better ways of interpreting the result? We can't, of course, set out research studies to answer every clinical question that we have. We need to prioritize them. So what is a priority question? Well, the most important aspect of this is to socialize that question. Asking our colleagues, is this right? Is this a good question to try and answer? What does the literature say? Have other clinicians in other centres approached the same question and found answers to it? What's the nature of their practice? If these explorations don't give us an answer, and we think this is an important question for patient care, then I think that that's a valid question to try and answer through research. So this is why a clinician researcher is absolutely crucial and one of the greatest advocates for patient care and the advances of patient care that we're all trying to achieve. So as a clinician, what are the first and most basic things that we can do to try and enhance our ability to do research? Well, obviously, discussing with our colleagues is critical. This can be a shared endeavour. But there are some very basic and important skills that we can all improve on. For example, increasing our word processing skills, enhancing our ability to use presentation packages, understanding databases and how to use those, reference managing packages, and also we can start to embark on upskilling our own statistical knowledge. There are some basic research skills and opportunities to learn these that are available to all of us all around the world. When we're considering the basic skills of research that we all need to learn, the most important is around ethics and ethical conduct, so that anything that we decide to undertake does not harm our patients or consumers. Ethical conduct is absolutely critical to undertaking clinical research. As clinicians, we are all extremely busy, and so it's really hard to find the time sometimes to take on other projects and research. But one of the things that can help us is the ability to collaborate and build teams. Collaboration is really critical to research. It enables us to bring people with different skill sets to tackle a problem. But also, collaboration should not be considered as a transactional relationship, but it's actually about building a relationship. For me, collaboration has been the greatest privilege and brought me the greatest personal joy because of the friendships it's created and the connections that I've developed throughout the world. So collaboration is not only practically important, it's also personally important and a really critical part of conducting clinical research. Now, all clinicians can upskill their research skills and how they assess the evidence that's out there. But for some, they may wish to take it further by conducting a research higher degree, such as a PhD. Clinicians who undertake a PhD develop unique skills and an ability to lead on answering clinical questions. There's a certain mindset that one learns through doing a PhD in terms of drafting clinical questions as hypotheses, determining what are the appropriate measures and what are the appropriate outcomes. There's also skill sets that can be learned in the methodology for certain types of clinical experimentation. For example, the PICO. This is the mechanism for intervention studies, where someone developing or framing a question might ask, what is the patient or population that I wish to study? What is the intervention? What is the comparison group? And what are the outcomes that I need to study? So, as academic leaders, do we recognize the traits for success in a clinical researcher? Well, certainly, a clinical researcher has to be engaged in lifelong learning. They have to be inquisitive. They have to have the ability to question their practice. They have to be able to remain humble when things don't go right. They have to be able to write well and be able to influence people. They have to be able to write grants and procure funding. They have to have a doggedness to continue when success doesn't come their way, particularly in relation to getting funding. Remember, as a clinical researcher, the most important thing is that you need to enjoy it. And if you don't enjoy research, then don't do it. But as an academic leader, recognize the interest in research in others in your departments and try and foster that culture and facilitate other people's journeys through research. If you've had success, make sure that you share that with your team. Make sure that you mentor others and make sure that you develop others in their journey in developing themselves as clinical researchers.